When a senator makes bold claims about Black maternal health in Louisiana, the stakes couldn't be higher. With some of the worst maternal mortality rates in the country, the question isn't about politics. It's about lives. But now he's defending his words. Is he shedding light on real issues or just dodging accountability? I want some of you to drop me respectfully comments down below and let me know, because inquiry minds over here want to know. I'm a registered nurse and I would love to talk about this topic. Let's break down the truth behind his statements and what this really means for Black mothers in Louisiana. Now, I'm going to read you a statement that he made. This statement was in, let me find it. It's NBC News. And I know that this is mainstream media and some of you out there are not all about the mainstream media. And I watch both mainstream and non-mainstream media. But these are his words, right? And so we're going to talk about his words. We're going to read through his words word for word as they quoted it anyway, because I didn't hear him say it myself. But these are quotes, and let me just read. Senator Bill Cassidy, Republican for Louisiana, is under fire for comments he made about the state of Black maternal health in an interview with Politico last week. Cassidy said that while Black people make up a third of the state's population and experience higher rates of pregnancy-related deaths, if you correct our population for race, we're not as much of an outlier as it otherwise appear. Now, I say that not to minimize the issue, but to focus the issue as to where it would be. For whatever reason, people of color have higher incidence of maternal mortality, Cassidy told Politico for the Harvard Chan School of Public Health series, Public Health on Brink. Cassidy also attributed the disproportionate rates to how the state defines pregnancy-related deaths. He goes on to say, sometimes maternal mortality includes up to a year after birth and would include someone being killed by her boyfriend. Cassidy said, in my mind, it's better to restrict our definition to that which is the perinatal, if you will, the time just before and in the subsequent period after she has delivered. I'm going to stop there for a minute because as a registered nurse, I understand that some mothers deliver naturally and some mothers have C-sections, which is a surgical procedure. And as a mom going through pregnancy, your body undergoes a lot of changes, and even the delivery would be as rough as on your body as having a surgical procedure. So with regular surgical procedures, there is a time post-op that the chances for mortality are increased, right? Because you have anesthesia risks, you have just the surgical risk, different things. And if you're a nurse out there, drop me a comment, let me know what you think. Or a doctor, that post-op, there's a period, there may be up to 6 months that there's post-op complications that could occur that could go on for about a year, right? And I say this because I'm going to go on to read. There's a comment that he made that because he says sometimes maternal mortality includes up to a year after birth. So I suppose if we're considering just a regular surgical procedure and we're looking up for regular procedures, we look at mortality up to a year after a surgical procedure, that a mother's birth, right, whether natural or surgical birth, should have the same definition. Okay, so with that said, now he does mention something about this includes someone being killed by her. This would include something being killed by her boyfriend. I don't know what the laws are. So if you are privy to that information, you can drop that respectfully down in the comments and share. Maybe the way the statistics are taken may need some adjustment, because I know that there's a lot of issues in the healthcare system. Like, we just had CEO Brian Thompson of United Healthcare be unalive due to what seems to be issues with the healthcare system. So we know that the healthcare systems and maybe statistics and we hear a lot that maybe statistics are rigged for different reasons. But what I need to understand in this situation here is, what is the benefit to the state, first of all, because in revamping this, in doing this, in changing and not just adjusting the definition, but it looks like he's saying if you correct our population for race, which means that you wouldn't consider like different races when to me, that's what it means, and correct me if I'm wrong, that you wouldn't consider different races when you're considering statistics. So you wouldn't do a stat for Black mothers, Latino mothers, Native American mothers, to see what the different numbers are. And I don't know, is this politics? Like, how does the state gain from making such a change is what I want to know. And then how does this, as a senator, how does this positively impact the lives of the constituents, of the people, of the mothers in the state? Now, if, like I said before, if we're considering like a mom that's been unalive by her boyfriend, maybe that shouldn't be included, because that has nothing to do with the birth, right? Like, that has nothing to do, maybe has nothing to do with the birth. I don't know. I mean, there are different things. There's mental health, but that you can't, maybe that's kind of been muddied. I don't know. You know how the stats are done, but somebody that, I'm not a statistician, I think is the word. So if you are, drop me a comment down below and let me know. Join the conversation. But I really want to know, because I want to know if this is, because right now with a lot of things happening, everybody is emotionally charged. And, every time something happens, we're like, we're taking sides, right? We're taking sides on the issue. But the side we should be taking is the side of the people, like what really matters, what really works, and what is the benefit to the people in doing this? What is the how do I want to say it? What is the detriment to the people in having the stats be the way that they are? Because there has to be something. To make a statement, to make such a bold statement, there has to be something. And is this statement related to politics for some reason? And if it is, what is it? And if it's related to improving health outcomes, what is the improved health outcome? So anyhow, that's all I have to say about the topic for today. I'm just interested because I'm just interested. I'm a registered nurse, and I work in the profession, and we develop standards by using some of these statistics. So what kind of health care does the mother get from the insurance company and the healthcare system if these stats are adjusted? So anyway, drop me a comment down below. Let me know what you think. Stay respectful, please. I'm trying to have a respectful conversation here. And I know some things are emotionally charged, but I'm just trying to keep emotions out of this and get like a clear answer as to what's the deal? What is the deal here? Let me know. If somebody knows, let me know and let's talk about it. All right. I will see you in the next one.